Blood pressure measurement is a tool used to diagnose and manage conditions like hypertension, and any error or mistake can give rise to inaccurate results which can affect the patient's care and management. That is why in today's video, I'm going to be talking about a very important but mostly overlooked issue, which is errors in measuring blood pressure, the impact it will have on the blood pressure, and the correct way to do this measurement. If that is the type of content you're looking for, stay tuned and enjoy the ride. Hello everyone, welcome to my channel Ask Your Nurse. This channel focuses on content related to health. If this is the first time of seeing my video, I'm Ashamu Oluwaseun. I'm a registered nurse. Don't forget to like, subscribe and hit the notification bell below to be the first person to know anytime I upload another new video. And to my returning subscribers, thank you guys for all you do. The first one I'm going to be talking about is wrong BP monitor. When you want to measure your BP and get an accurate result, use the standard BP monitor. Don't use those wrist one or use the watch on. You might not get an accurate value like that. Use the standard one that is approved. And another error that people make when measuring blood pressure is cough over cloth. When you want to measure your blood pressure, you're supposed to roll up your cloth and apply the cuff directly on your skin, not over the cloth. If you put your cuff over the cloth, it's going to give you a high level, which might not be the accurate level of your blood pressure. So anytime you want to do your blood pressure, ensure you roll up your cloth and put the cuff directly on your skin before you measure it. Another error that people make is the use of the wrong hand. The correct hand you're supposed to use to get an accurate blood pressure is your left hand. You can only use your right hand if the patient has injury or fracture on the left hand or contraindicated. That is when you should use your right. But the correct hand you should always use is your left hand, and use it every time you want to measure your blood pressure. Another error that people make when measuring their blood pressure is wrong arm position. You should position your hand at the level of your heart. When you want to measure your blood pressure, it should not be below and it should not be above your heart. When it is below your heart, when your hand is dangling down, it can increase your blood pressure, which might not be the actual blood pressure you're having. And when you raise it, it can bring down your blood pressure. So the correct position you're supposed to put your hand is at the level of your heart. Another mistake that people make when measuring their blood pressure is taking blood pressure when they are not at rest. Your blood pressure is supposed to be measured when you are at rest, when you are relaxed. When you enter into an hospital, ensure you sit down for like 5 minutes before you take your blood pressure, or even when at home or when you just finished exercising, you rest before you do your blood pressure. When you are rushed or when you just finished exercise and you do your blood pressure, it's going to give you an elevated value, which is not the correct value of your blood pressure. So ensure you rest before you do your blood pressure to get an accurate result. Another mistake that people make when measuring their blood pressure is having full bladder when taking their blood pressure. It is very wrong. When you have full bladder when taking your blood pressure, it will elevate your blood pressure and can increase your blood pressure by as high as 15 millimeters of mercury. So ensure you empty your bladder before you take your blood pressure to get an accurate result. Another mistake that people make when measuring their blood pressure is wrong position. When they want to do their blood pressure, some people might be standing and still taking their blood pressure to give you wrong value. Some people, they will sit down and cross their legs, it will give you wrong value. Some people, they will bend like this. The position you're supposed to be when you want to measure your blood pressure is a relaxed position. When you cross your leg, it can elevate your blood pressure. Another mistake that people make is talking while taking their BP. When you are talking when measuring your blood pressure, it will elevate your blood pressure. So ensure you keep quiet when you're taking your blood pressure measurement. Another error that people make is taking caffeine before their BP. When you take caffeine before taking your blood pressure, it will elevate your blood pressure to give you an artificially high blood pressure. So you ensure you avoid caffeine or your early morning coffee before you measure your blood pressure to get an accurate result. You can take your coffee after you have checked your blood pressure. Another error that people make is too tight cough or too loose cough. Your cough should be applied moderately. It should not be too tight and it should not be too loose. When it is too tight, 2 fingers will not be able to enter. And when it is too loose, you'll be able to put 4 fingers inside it. When it is too tight, it will give you an artificially high volume. But when it is too loose, it will give you an artificially low level. So ensure that it is moderately tight. Another error that people make is wrong timing. BP can vary at each time of the day, and the best time to measure your blood pressure is in the morning, after you wake up in the morning, before you take your early morning coffee or before your early morning exercise. Check your blood pressure, and you can take it before you sleep at night, that is twice a day. Take it in the morning immediately you wake up and at night before you sleep, but it can be before dinner or like 30 minutes after dinner. Take your blood pressure. It will truly represent your blood pressure like that. Then you can take it like twice or thrice with 1 minute interval to really check, and now take the average value to represent your blood pressure. And when you see that your blood pressure is persistently high, please see your doctor immediately. And the last error that I want to talk about today is one take one diagnosis error. It is an error to take the blood pressure once and diagnose the person of having hypertension. The blood pressure can be high because of so many factors, and that person might not be really hypertensive. And a true hypertension is when the blood pressure is persistently high in more than 2 readings. So you don't just take blood pressure once and diagnose the patient of having hypertension with that one reading. No, it is an error to do that. Thank you so much for watching, and I hope you've gained something today. Please don't forget to share this with others too who can benefit. And see you next time.